Hi, Claire. Good to see you.
Hi, good to see you too.
You just started this rotation, correct?
Yeah, I started this past Tuesday, and I'd actually like to precept with you about a patient who's here for an abortion today, if that's okay.
Sure.
My patient Anjali came to me 2 days ago for a pregnancy test. It was positive. She was sure she wanted an abortion, so I scheduled her for this morning's procedure clinic. She's 32 years old. She's 7 weeks and 5 days pregnant today by LMP. She's had one previous pregnancy and a vaginal delivery 3 years ago. No other health issues.
Okay, great. And have you spoken to her about the procedure?
Yeah, we've gone over the procedure. She signed the consent form. I have the Sano available in case we need it. I think she's ready for us to get started.
And have you ever done an aspiration abortion at the family medicine clinic before?
Yeah, I've done 3 in the last year, but it's been a while.
Excellent. Let's review a few things quickly because we like to respect the patient's time. Do you know if she wants to be alone or if she wants to have someone with her?
She brought a friend with her today, and she wants her to stay in the room. I think it'll be really nice for her to have that extra support.
Great. It sounds like you know the patient really well. Since we've never done a procedure together, I'd like to go over a few things before we get started.
Sure.
There are 3 things that are important to me. First is the patient experience. Second is keeping with the flow of the clinic. And finally, focusing on your learning, which is important, but third for me on that list. Does that make sense?
Yeah, I've never really thought about it that way, but that makes total sense.
So my role during the procedure is to make sure that it's comfortable and safe for the patient, but also feels safe and comfortable for you.
Yeah.
Now, let's focus on the procedure. I keep a model tray here for learning. Can you tell me what the steps of the procedure are?
Yeah, so first I'm going to start with the bimanual exam to check the position of her uterus. Then I'm going to insert the speculum so we can visualize the cervix. And then I know some places have some sort of antiseptic wash and other places don't.
Yeah, we're not doing that here.
Okay, so then I'm going to give a little bit of lidocaine before using the tenaculum, give the rest of the paracervical block. And then I see we have the metal dilators here, not the plastic ones.
Yeah, we've been using the metal ones here recently because they're easier to sterilize without melting.
Got it. So then I'm going to dilate up to a size 25, and then I'll use this cannula, and then I'm going to use the manual vacuum aspirator to remove the pregnancy.
Yes. I'm glad we reviewed this. It sounds like you have the steps of the procedure down really well.
Thanks.
There may be situations in which I'm going to interrupt you and do parts of the procedure myself. This may be because you've forgotten a step or just because you're too early in your training and we don't want to take too long. Again, this helps both the patient and the clinic flow. If I need to get your attention, I may do so in one of 3 ways. First, I may use your name while I'm speaking to the patient. For example, Dr. Roberts is going to place an instrument on your cervix, which is really my cue to you that you need to place the tenaculum on the cervix. So, if you hear me talking to the patient and I say your name, it means I'm really talking to you. Because I don't want to draw attention to your learning process and possibly bother the patient.
That makes total sense.
Second, I might need to take over the case at some point. I like to give trainees a heads up before I take over because the patient's awake and listening to us. So if it's okay with you, I might tap you on your shoulder, which is an indication for us to trade places. You just have to trust me at that moment.
Okay, that's fine.
And finally, if I need to take over the procedure, I'll let you know when you can resume the case. I may say something like, Dr. Roberts will be finishing this part of the procedure.
Got it.
So those are the 3 big things to pay attention to when we're doing the procedure together.
Great. Thanks for making all of that clear.
No problem. Just one last thing. The way we talk to patients during the abortion procedure is really important, but you may find it difficult to talk to the patient while you're doing the procedure. For today, I will do most of the talking, but I'd like you to pay attention to how I phrase things. If any of the things I say stand out to you, let's talk about them afterwards.
Great.
Ultimately, you're going to develop your own style of communicating with the patient during the abortion procedure.
Awesome.
So let's go see the patient.
Hi, Anjali.
Hi.
This is Dr. Green, my supervisor.
Anjali.
She's going to help me with the procedure today.
Hi, I'm Jamie. Thanks for
Nice
letting
to
me
meet
be
you,
here.
Jamie.
So we've already gone over a lot of information, and you've taken your antibiotic and your ibuprofen. Do you have any other questions before we get started?
No, I think I'm ready.
Okay, great. We're going to wash our hands and then we'll get ready to start the procedure.
Okay.
Okay, Anjali, so before we start the procedure, I like to ask the patients how much they want to know. Do you want me to talk through each step, or do you prefer that we talk about something else?
I think I would like to know each step as it happens. I just don't want to be surprised by anything.
Sure, we can do that.
Yeah. So the first thing we're going to have you do is get into position. So you're going to move your bottom to the edge of the table, and you're going to put a foot in each of the footrests here.
Okay.
Okay. I'm just going to adjust this a little bit.
Thank you.
And how is this position?
It's okay. It's fine.
Okay. So both Dr. Green and I are going to do an internal exam just to check the position of your uterus in preparation for the procedure.
So you're going to feel some cold gel in my hand and some pressure. How are you feeling?
I feel okay.
Okay, this feels like a small early pregnancy, so I don't anticipate any problems during the procedure.
Oh, that's great.
Okay. So I'm going to repeat the exam in preparation for the procedure. How are you doing so far?
I'm okay.
Okay. So you're going to feel my touch, some pressure. Okay, I'm gonna go ahead and insert the speculum. You're gonna feel some something cool, and you might feel some pressure.
So Dr. Roberts tells me you're a 4th grade teacher.
Yeah, I am.
That's great. My mom's a teacher too.
Oh, that's nice.
This part of the procedure is similar to a pap smear. I saw you wince. How are you feeling?
It's really uncomfortable. Something's pinching.
Dr. Roberts can adjust the speculum.
Is that any better?
Yeah, that's much better. Thank you.
Okay. Okay, so now I'm gonna use an instrument to help hold the uterus still during the procedure. You may feel a little bit of pinching or cramping with this. Everybody's a little bit different.
How does that feel?
It's not too bad.
Okay.
And now Dr. Roberts is going to give you some medicine to help with the discomfort.
So you may feel some stinging with this.
What are you feeling?
It's getting a little uncomfortable, but it's okay.
Is this part going to last much longer?
This part is almost done.
Okay. So now I'm gonna slowly stretch the cervix. You may or may not feel some cramping. Just let me know how you're doing.
Just take some nice deep breaths in and out. How are you feeling?
It's starting to get a little crampy.
What you're feeling is normal. Would you like us to keep talking, or do you want us to be quiet?
Let's keep talking. It's helpful.
So how long you been teaching 4th grade?
About 4 years now.
Have you always taught 4th grade?
I used to teach kindergarten.
Yeah, we teach together, and she's really great. All the kids love her.
I'm going to take over this part of the procedure so it can go faster for you. Just take some deep breaths in. How are you feeling?
It's still cramping.
What are the cramps like in comparison to your periods?
My periods are pretty rough, so they're about the same.
Just take some deep breaths. Dr. Roberts is going to finish up the rest of the procedure.
Okay, this last part should take about 1 to 2 more minutes.
You'll feel a little bit more cramping as your uterus is getting smaller. This is the pregnancy coming out. Just take some deep breaths in and out.
Okay, so your abortion is done. Everything went well.
That means you're no longer pregnant.
Really? It's over?
It's over.
That was way quicker than I thought it would be.
That was super fast.
Yeah, it's a very quick procedure. So you can lay here and rest on the table if you'd like, or whenever you feel ready, you can get up and get dressed.
How are you feeling right now?
There's still some cramping, but it's getting a little better. Yeah.
Yeah, the ibuprofen that you took earlier should have kicked in by now, so it should help with the cramps over the next few hours.
Okay, that's great. Thanks.
Anticipate that your cramps will get better, and Dr. Roberts can go over with you what to expect in terms of how you'll feel the rest of the day. You can go back to your usual activities, such as lifting your child, having sex, using a tampon, and you can return to work whenever you're up to it.
Okay. Thank you so much. And thanks for letting my friend stay with me. That was really helpful.
I'm really glad I could be here with her.
Claire, I think that went well. How do you think it went?
Well, I'm always really surprised at how quickly the procedure goes. I feel like it was okay at first, but I almost forgot to give the lidocaine. So thank you so much for reminding me.
Of course. You recognized my cue when I said your name while speaking to the patient.
Yeah, that was really helpful.
So let's talk about what happened during the dilation. How was that for you when I tapped you on your shoulder?
Well, I'm glad we had talked about it beforehand. That way you were able to just take over and you didn't have to say anything, and I wasn't surprised.
And do you think I came at the right time?
Yeah, I mean, it was hard to know if the dilator was going in the right place or if it was going through the internal os. It was just hard to figure out.
Mm-hmm. And how do you think you'll know that once you get more experience? Have you spoken to somebody about it?
Yeah, some people say, people say it's like a feel, but I guess I haven't really done enough procedures to know what that feeling is.
Exactly. It's kind of a feel. Can you remember what it felt like when you were trying to dilate before I had to take over?
Yeah, I mean, the first one went in easy. I didn't even feel like I had to position it. It just went right in. The second one, though, was harder to get to like that same spot.
Yeah. Was there anything that you noticed that I did differently?
Yeah, your hand position seemed to be a little bit different. I had angled up and you had angled down. I don't know, maybe the angle needed to be different.
Yes. It's great that you noticed that. The angle is really important. Another thing I did was place more tension on the tenaculum so the uterus moves less and it's easier for you to put the dilator through, which I know trainees in the beginning are worried about doing. But it tends to straighten out the canal so you have a better chance of going through with the dilator. So those are 2 things you can do next time that may be helpful.
Got it. Yeah, I'll definitely try that the next time.
And how did the end of the procedure go when you resumed the case?
Well, I'm feeling more comfortable releasing the valves on the NVA. And I did feel the grittiness at the end of the procedure.
That's great to hear. You'll get even more comfortable each time you do it. Let's talk about language. Was there anything I said during the time we were in there together that stood out to you?
Yeah, I mean, I just appreciated the way that you talked to the patient. I didn't anticipate how hard it would be to do the procedure and talk to the patient. And I noticed that you asked her what she was feeling instead of trying to tell her what she might feel, which was interesting.
I think it's great that you helped her anticipate what's coming next, but it's also helpful to check in to see what the patient's experiencing. Anything else you noticed that you want to incorporate for the next time you're doing an abortion?
Yeah, I mean, I just appreciated the way that you talked to Anjali about the things going on in her life. It seemed to keep her mind off the discomfort.
Yeah, in my experience, the patients are really grateful to talk about something else. Some patients prefer music, others patients prefer that it's quiet. It's important to allow for a wide range of preferences during the abortion procedure.
Oh, yeah, and I also noticed that you had told her she could go back to all of her activities. I've heard some conflicting things about follow-up instructions. You just made it seem so simple.
Yes, there's a lot of conflicting advice out there, but there is no clear medical evidence in regards to these restrictions. So we encourage women to resume activities when they feel comfortable.
Yeah, that makes total sense.
One thing that is important to state to every patient is you are no longer pregnant, because we know the patients are worried that the abortion wasn't complete.
Yeah, I hadn't really thought about it that way, but that makes sense. I mean, we know that the pregnancy is out of her body, and we know she's not pregnant, but we need to tell her that.
Exactly. Overall, your approach to the patient was calm and reassuring. I think your transition of letting me take over went really well. You resumed the procedure and completed it, so you're on your way to developing more skills.
Thanks. Is there anything else I should focus on for the next time?
If you feel like you're having trouble with dilation, try some of the strategies we talked about. But it's also good to know your limits and look to your trainer for help. With more experience, you'll get a better feel for each part of the abortion. You'll also get more comfortable performing the procedure while conversing with the patient. You probably won't do things exactly the same as your trainer, but feel free to take part of what you learn from each of them and incorporate it into your own style.
Great. That's so helpful. Thank you.
Great. Let's go see the next patient.